So basically, we service anyone 0 to 18, the same ages as the base Children's Hospital. We not only do we see children here within the school, we also have opened our doors to community. So that's basically who we actually see.
That's great. And maybe can you speak to like what a typical day is like here?
Well, it depends on what Felicia wants me to do. We see a typical day, probably recently we've been averaging, 10 to 15 patients a day. Sick visits, we do a lot of asthma follow-ups. We have a lot of children with asthma in the school. We follow all the asthma children in the school. Well child checks, sick visits, ADHD, sick visits. And they're constantly, the school nurse refers a lot of kids too, so if they come in to see her and they're sick and they're consented with us, we'll go ahead and see them.
Okay, great. And just because a lot of your like patients and families come from the Avondale community, are there things sort of about Avondale that maybe you'd like to share for other providers? Some of either like the challenges they face or.
Well, one challenge that they do face is trust. So considering that it's only the two of us here, we are the staff. It's myself and Melissa. So they like consistency. They like to see the same person. And when they call to schedule appointments or need advice, they will get one of us. So I know a lot of our parents have said that. That sometimes, if they do go to PPC, even though they may have a specific provider, but they, can see different providers every time that they go. So that's one challenge that, that's really not a challenge here.